Here's two scary words for you. Gum disease. You've probably heard your dentist talk about it. It's prevention, but is brushing and flossing enough to keep it at bay? Well, Dr. Keller says, you know what? Probably not. He's joined by his patient, Sharie Kruger. And so we've heard this for eons. Brush and floss, brush and floss. But I know some people still get cavities.
I know, it's in the way.
Still get cavities even though they brush and floss.
Sure.
So what's this system that you've come up with?
Well, first off, brushing and flossing, I'm not saying not to do it.
Right.
But a toothbrush only gets 1 millimeter under the gum tissue, so it never reaches the bottom of the pocket. And floss only removes 15% of the plaque that's there. So the system that we've used is it's a tray that uses a very mild hydrogen peroxide gel. The hydrogen peroxide controls the bacteria that causes the disease. So if you control the cause, you don't have the disease.
Well, the question then becomes, does it work?
Well, there are at least 2 independent studies.
And then you ask, would I be here if it didn't?
Well, no, there are 2 independent studies that clearly show that it's far superior to scaling, root planing, and all the things we've done professionally for all these years that leaves the bacteria there.
Right. Well, how often do we have to do it?
Well, once, twice a day.
Okay, but it's not a timely commitment?
No, I mean, it's so simple to use.
You carry one around with you?
I brought one with me just for the heck of it.
Borderline weird, Dr.
Yeah,
Keller.
I know. Well, you know, hopefully I didn't put strychnine in there. But that's it.
That's it?
Medicine's in there. How long does that take?
Not very long.
Not very long.
It took you longer to get it out of your pocket.
Yeah, it takes me longer to take it out.
Yes.
But I talk better without it, so that's the only reason we'll take it out.
So,
but no.
So Sharie,
Yes.
you've used it, and your husband uses it as well, right?
Yes,
But
that's-
you have your own. They're different.
Yes. I don't use his. We're not that close.
What?
And I've been using it for about 8 years. You
All
put
right.
it in, you put the trays in.
Well, first of all,
Yes.
tell me your experience going back. Have you had problems with gum disease? Have you had...
I have not. I've always had a very healthy mouth.
Okay.
My husband, on the other hand, was a smoker. Heavy smoker for 30 years. We finally quit. Yay! But and the cigarette laid right on this right side of his mouth.
Right.
And his gums were a mess. But I married him anyway.
Never look the gift horse in the mouth, right?
Right on.
Literally.
You got to take it where you can get it. So I had already been using the Perio Protect, kind of got him converted over, and it's been nothing short of miraculous.
Well, see, but we talked about this as preventative measure.
Right.
This was a healing measure.
Yes.
Right. You can
For
use
Brian, it was.
Yeah, you can use it as a treatment method in conjunction with, you know, the other things we do professionally. But then it's the prevention method to keep it from coming back to protect your gain.
Sure, preventative maintenance, but I
Right.
mean the
Right.
fact that you were able to heal it, and is that a
Right.
common thing for smokers, that they have a higher risk,
Yeah.
a higher rate of...
Right, and truthfully, Kent, in today's age, we cannot continue to afford to pay to treat disease if we can prevent disease.
It's a good point. It's a good point. It's money well spent.
Right.
Pay me now or pay me later is
Right.
kind of your ad. Should be your attitude.
and
in
what
this kind of thing.
what we've shown in our studies is that patients pay 4 times more that don't prevent.
Wow. All right. Seems pretty simple to me. Thank you, Dr. Keller.
You're
Sharie,
welcome,
happy
Ken.
holidays. Thanks
Thank
for
you.
coming in. Nice to meet you. And congratulations to your husband and on the quitting the smoking
Yes.
too. That's great. If you're experiencing any of these problems, give Dr. Keller a call at 314-638-4190, or you can always check out his website at dwaynekeller.com to learn more about Perio Protect. You'll have